You are now listening to the Project Kuwait. Where we stop at nothing to bring you the right facts on health, fitness, and psychology. Featuring some of the world's most experienced professionals so you can learn, live, and live. With your hosts, Meg, Dr. D, and Mahdi.
Hey everybody, welcome to this episode of Psyched with Dr. D. And in this episode, me and Dr. D discuss whether it's okay to let your kid cry or to tell them to tough it out. We kind of have a little bit of a debate for the first 15 minutes in regards to that subject. And then we get into COVID-19 and becoming a hypochondriac, the associations. Is it okay? What's not okay? What is it good for? And what should we do if we know someone that is doing that? How can we be a good support system? That's all in this episode. And don't forget to leave us a rating and review.
All this and more in today's episode.
In this episode of Psyched with Dr. D, she is going to ream me a new one because I told my 5-year-old, good job for not crying, buddy. Way to keep it in there and hang in like a tough guy.
I couldn't believe that you do that as psychologically found at you. And you are doing Psyched with Dr. D. And we've talked a lot about emotions. I can't believe you're teaching a 5-year-old not to cry. I'm disappointed.
Look,
what were you thinking?
Look, it's instilled an innate reaction that I have as a male adult that I grew up with. And I actually would like my son to grow up with it too. This is my personal opinion, that sometimes the weak get fed on by the strong. And in school and in other places, when a kid is seen to cry more than other kids, like a couple of friends I had when we were younger, and he cried a lot. You know, he got his butt handed to him a lot of the times, and we had to defend him. So it's a societal weakness when you cry in front of people.
Hold on. You're missing the point. First of all, we're talking about a 5-year-old who is okay to cry because when he gets a little older and he's a teenager, I'm sure he himself, because the society will give him enough cues that he's not going to cry. The other thing is that the idea of, you just said, the weak and the strong. Are you trying to say that people that cry, men that cry, and women that cry, they are weak?
No, I cry, but I don't do it in public. I mean, I cry. There's nothing wrong with crying. Crying is fine. No, crying is fine. But there are certain times, there are certain situations, like if you get into a fight, okay, because boys get into fights, all right? So do girls. And when you get into a fight, the first one that cries loses. And I have grown up with a very male-dominant upbringing, so to speak. So for me...
The alpha male, I understand, but he's 5. He's with his... But he's 5. He's with his parents, which he should feel comfortable and safe to be able to do that. And when he gets a little older, then you can identify the different events where he can cry now. Having him cry now does not kind of reward that he's not going to be an alpha male or that he's going to be a strong man and that he's going to cry later. It's just a stage. Would you say that if you had a daughter who's 5-year-old, now if she would have fell and not cried, I'm sure you would have probably wondered, it's okay,
no,
baby,
I would have given her a pat on the back and said, tough girl. I would have done the same exact thing. Whether it was a boy or a girl, I would have treated the situation. Because here's my opinion. When you reinforce a child because they fall and cut their little baby toe once or twice and they cry, and you run over and rush over to them and you give them all this attention, then they continue to cry because it brings on more attention. Now, there are certain situations where if DJ is sad and he's emotional and he cries, I say, buddy, it's okay. If you need to cry, get it out. That's fine. You're upset, and this is a time to be upset. But
falling off your bike and hurting yourself.
He didn't get hurt.
Let's say he fell and he hurt himself. That's still an emotion. There is pain, which means that I will cry. I mean, any of us, when we have pain, the first thing we do, we either scream or cry. So the idea is that he will understand that these were situations. I'm sure that when he's in high school or middle school, he's going to realize that he's not going to cry. And if he cries the first time and somebody says something to him, he should know better to say, look, crying is an emotion of sadness, of pain, of many things. And now this is a hypocrisy, really, Mahdi. Come on. You're being a hypocrite.
A teenage boy in high school.
He's not going to cry in high school.
If a teenage boy in high school, in my school where I grew up in, came out and said, look, this is an emotional thing, he would have gotten his ass beat. Like, let's be
But
realistic.
we're not talking about, no, but let's be realistic. We're talking about you're making an assumption that if he cries right now, it means that it's going to carry through till he's high school. You're making that assumption. Or we're saying we need to get kids to be able to experience those emotions now, and then we'll have a conversation. So if they're crybabies and they're crying all the time, when he gets a little older, we'll have that conversation. But I feel like you're really trying to advance things for his age. I wanted to say it in Arabic.
You just said it, though. You just said it. If he turns into a crybaby, my whole goal right now is to make sure he doesn't turn into a crybaby.
But he's not going to if he's riding a bike and he fell and he hurt himself.
It was a tiny fall. Like, he fell 5 times today. He fell 5 times.
But you reinforced it by saying, good job, you didn't cry.
But
tomorrow, when it's a bigger thing, he's going to try to hold his tears because he's going to say, Daddy, I didn't want to cry because I know you told me not to cry. And that's the problem.
If it's a hard fall, he's going to cry. But today, look, the first fall was not a hard fall. And as soon as I saw it, I was like, dude, you don't need to cry. You're fine. And I was like, good job. You didn't cry. And then every fall after that.
Why is it a good job? You didn't. Why couldn't you have said good job the way you handled
Dr.
the bike?
D, some kids overdo it with crying. I want to make sure he doesn't want to.
Mahdi, why did you bring in crying to this situation? You could have said, good job. You handled the bike very well. As a 5-year-old, you've learned so well how to fall and pick up yourself.
I did say you handled the fall really well.
So why did you bring in the crying? You yourself told me that, hey, I gave you dirty look.
Oh, yeah. Hay's always pissed when I say that.
Of course, because you are reinforcing a behavior that it is not normal. It is okay for them. And believe me, when he gets older, he's going to realize when to cry, with who to cry, and with who not to cry. Making an assumption that if I don't say these things right now, he's going to grow up to be someone that is going to cry and people are going to bully him. It doesn't make sense.
Can you deny the fact that there are 5-year-olds out there or 6-year-olds out there where if they just trip a little bit and they start bawling and crying, their parents give them all this crazy attention that they feed into positive, it becomes positive reinforcement to crying, correct? I am trying to nip that in the bud early. When DJ cries based on emotional stuff, like if I take his Switch away and he's like, I'm really sad, and he starts crying, I'm like, it's okay, buddy. Get it out now. That I'm fine with because that's an emotion I don't want him to bottle up. But if he's falling and it's a reenactment, he needs to be tough and falls. Like, what if he's playing in a soccer game and he gets a skin knee? He's going to just bawl in the middle of the soccer field?
It's the messages. So he could have fall. And you can give him mixed messages that when I take your Switch away, it's okay for you to cry. But if you fell on your bike, I want you to be tough and be a man in a way. I mean, you're not saying those words, but you're insinuating that. So obviously, he's only 5-year-old, and we should not give them mixed messages that you can cry when I take your Switch away, but don't cry when you fall off of your... It's the message you could have said to him. You're talking about these parents that they give extra attention to their kids because they fall and they injure themselves. It's the message we give. We can still support them. We can still give them comfort and say, look, now we need to start. And when they get a little older, they're going to start learning, and we can teach them that, look, you have to be able to handle some of life's stressors like we do with teenagers all the time. But I don't think a 5-year-old needs to hear any of those lectures. Let him be. Don't make any comments about you crying. And
all
don't
I said
cry.
was tough guy.
You're already in.
Like, I gave him a pat on the back. I was like, good job not crying. Tough guy. So there's nothing wrong with that.
Good. Don't
There's
bring the word
with
crying. Just say tough guy. I'm so proud of you.
Can you deny there are some people that are tough and some that are not tough? Like, I can take a punch to the face and not cry. And there are other guys that take a punch to the face and they're going to cry.
But it doesn't make you better than the other people.
It doesn't,
who are
but
crying.
that means I can take a punch. He can't. That's life, though. That's in general.
No, but people that have gotten a lot of punches in life, even though at first they didn't really handle it, they will handle it a little later.
It's true.
We just got to allow our kids to be able to experience. So, of course, the kid that doesn't know how to take a punch, I can guarantee you that he probably was pampered and was never allowed to see any stressors. But kids that are, at first, they couldn't handle it, they've become resilient because they've had a lot of stressors. So it's all about what life brings them. It has nothing to do with their personality. And are some people more baby than... Yes, there are a lot of more kids are baby than others, but doesn't mean that when they get older, these kids are not going to learn a tough lesson in life and toughen up.
See,
it's not genetic.
That's the beauty about our show. People get both opinions. They get the psychological doctor's opinion, and then they get the real life dad's opinion. It's all good. It's all good. Let me point out to the record that I did say, good job getting your hands down first. That was the first thing I did say to him.
Oh, and then you ruined it by saying crying.
Yeah, okay, yeah. Well, in your opinion, everyone has a different opinion, but
and his opinion.
But to all his opinion is bad day. We'll talk about that one later. But to all the parents out there, in all honesty, like I think a lot of parents, when they teach their kids how to ride bikes, okay, and this is to give everybody some advice on teaching your kid how to ride a bike. Let them start out on a balance bike first. Don't do the crap where you take one wheel off the training wheels. That shit doesn't work. All right. DJ had a balance bike. He gained his confidence there. I took his training wheels off. It's hard work because I was literally running after him, holding the back of the seat. And I was doing what you do when we teach people how to do handstands. So when you teach them how to do a handstand, they get their legs up, right? You use your hands on either side of their feet to keep them balanced. So when he was on the bike for the first time, that's what I was doing. I just had my hands on his side and on the back of the bike to keep his balance. Once he got his balance and the confidence, that was it. That was all she wrote. He learned how to do it in a day. I know parents, they've had their kids on the whole one wheel on and one wheel off. I tried that approach. Didn't work. And this was just like, I was like, oh my God, like, why aren't other people doing this? Because it's hard work.
Or because they're worried about that they might fall or hurt themselves or whatever. Can I confess to you? Do you know I don't know how to ride a bike?
Really?
And it was all my parents' fault. Yes, I don't know how to ride a bike because I was trying to learn how to ride a bike when I was small and I fell and they never put me back on it. And since then, and now I'm too old to be learning a bike. So that's something I feel like, parents, it's very important for parents when your kid falls. It's okay to reassure them. It's okay to say, these things happen, but put them back on the bike or in the pool or whatever it is. But no, my parents, maybe that's why I became a psychologist. I was traumatized by a lot of stuff. So they never, maybe they didn't want to deal with any more injuries. And I was the kind of kid that really got injured all the time. So I don't know, but I didn't. That's it. It was over. One time I fell and that's it.
To go back a week ago, DJ did have a bad fall his first day on the bike. Like his first time riding solo, he had a really bad fall. And when he did cry and it was bad enough, I picked him up and I said, it's all right, buddy, let it out. And I was patting him on the back because that's when I knew that he really ate a mouthful of dirt. Like that was a tough fall. And I was so proud. A half an hour later, he was back up on his bike, believe it or not.
Good. See?
Credit to Haya. She was like, DJ, show Baba Abdullah how you can ride your bike. And he got on for like 2 minutes and we didn't push it. And thank God, I mean. But
see?
If you want to learn how to ride a bike, I can teach you. Apparently, I'm a good teacher.
Really?
It's never too late.
I need a trailing wheel. It must be late because I wouldn't know how to balance myself.
It is not too late. It's never too late, Dr. D. It's nothing
Every time
is
I
ever
want to
too
ride,
late.
I mean, I feel like I want to ride with my kids. I feel like the bikes for my age or these adults are not going to work for me. I need a bike that would be like a training bike. There's no training bike for
they have
adults.
those. No, they do. They have those.
Well, whenever we go to Chicago and we rent it on the lakefront, then I take the one that has like the training wheels, like the three.
The three-wheeler?
The
three-wheeler is a perfect one, yeah.
I mean, because it's the only way I'm going to ride while the kids are taking bikes on their own. And here I am, the only one. All my friends know how to ride. Like all my siblings do, except me.
To be honest with you, you're not missing on much. I had a bike in my house. Like literally, I bought it, sat there for 3 years. I used it twice.
Really?
Yeah. So
okay. I'll just use my legs and run and walk, I guess.
There's nothing wrong with that. Speaking of walking, how was your walk today with the kids? I heard you were telling me earlier that you had a code red and you guys had to run at the end.
You know how you're walking and I don't wear a watch. I don't do anything. And I take sometimes I don't have the pocket. So I let the kids keep my phone. So I'm not checking the time. And here it is at 6:15 and we're all the way on another end of our neighborhood. And I start panic. And I don't know. I think my daughter's starting to have anxiety. So she's like, Mom, it's 6:15. She started looking at my phone all the time. Mom, it's 6:17. And I'm like, okay, Larsa, nothing will happen. It's not like 6:30, you're going to have all that. And obviously nobody was even in the street at 6:30 because everyone's eating futur. So I'm sure the cop is not going to come after me. And she's like, started running. It helped her because at least at first they were lagging behind me. She doesn't think this is an exercise. She thinks we're just going out.
Going for a stroll.
For a stroll. She's like, why are you in a hurry, Mom? I said, because I thought this was the purpose of this. We need to exercise. And then she started running. She was panicking. We barely made it to the house at 6:30, but there was no problem. I was like, see, why are you worried? Come, Mom, let's run. I'll meet you all the way to that building. Like she started to really cute. Panic. But it's good because normally I'll walk and then I'll come home and run like 20 minutes on the treadmill. But today I said, no way, I already ran enough. I was like jogging until we can get home. I don't know why we panic. I guess, I like to follow rules.
Do you enjoy the treadmill? Just out of curiosity. You do?
I like running on the treadmill.
What do you do? Listen to music or watch TV?
Yeah. No, I listen to music. And then it helps me when I listen to music. Or I talk on the phone.
I can't do treadmill. I feel complacent. I don't feel like I'm accomplishing anything. I feel like I'm just running in place. You know what I mean?
Yeah.
Whereas if I'm outside, if you put me on a treadmill and say run for an hour, I'd rather kick myself in the teeth. But if you tell me go outside and run for 2 hours, I could easily run for 2 hours outside.
See, I'm opposite. I can run on the treadmill for 20 minutes, no problem. But then today I was like huffing and puffing. I was running. It's jogging, actually, not even running. I'm stopping. And then I walk fast. And then I jog again. I'm not a runner, really, but figured, okay. And then, but on the treadmill, I enjoy because when I'm walking, I'm not really listening to anything.
Yeah.
Because their kids are with me. I need to hear what they're doing. But here, I just listen to music. And with the music, the time passes. Or I talk on the phone. But whatever.
You don't listen to the project. You don't listen to the podcast. You don't listen to any of our old episodes.
Hey, this is a good idea. I'm going to start listening to all the podcasts.
You need to listen to
I need to listen to your other one. I need to listen to your Sunday
No, don't listen to the other one. I trash talk you in that. Yeah, I talk trash about you.
Really?
No,
I have to listen to this.
I would never do that. I would never do. Speaking of that, I don't know when this episode's going to air, but by the time it airs, we will be the most downloaded Quady podcast ever.
Yay! So, all right. We have been having good numbers.
Oh,
That's great.
Yeah. No, we're definitely doing
Aren't you
really
proud,
well.
Mahdi? You started this.
I'm proud of all the work that we did as a collective team. I think it's awesome where we started and where we are now, especially to see the numbers for this, just the Project Quate in general. The numbers are awesome. And I love the fact that we have listeners in France, Spain, Australia, Italy, Norway. I mean, the countries just keep going. Argentina. We have listeners all over the world, and it's been awesome. And
that's great. Thank you guys for listening to us. That's great.
Do you want to know what the number is?
Yeah, I want to know the number.
50K.
Wow.
Yep.
Amazing. Yeah. Thank you, guys.
Yeah.
Yay.
Yeah, and make sure you guys leave us ratings and reviews because honestly, it's the ratings and reviews that do a lot because once people leave us those ratings and reviews, it helps the show by boosting us and giving us a little bit more exposure out there. So there was my shameless plug to all the listeners.
Yes, thank you guys. And I'm glad that we're making a difference because when you and I talked about doing the Psyched with Dr. D, I mean, it was all about disseminating information and educating people in a fun, non-threatening way so people can relate to it. And, you and I have shared our own struggles with things and we've talked about a lot of difficult things, but an easy way. So I'm happy that people are listening and are finding this show and the Project Quate helpful. It's really great to see. Finally, it's like as a psychologist, when I work with someone and then finally you start to see them are really realizing what is wrong with them. They're making the steps. It's so gratifying, to be honest.
No, it is. And honestly, and I'll say this on the show and I'll say it to you. I've been struggling so much the last 2 weeks. Like the whole Corona thing and the quarantine thing for the first few weeks was okay. I was getting by. But the last 2 weeks, I've really, really been struggling with just finding that motivation to just get the basic things done. That for me was an uplifting high, so to speak. It's something that I needed. It was one of those small wins and it was just good. It was good. And just so everybody knows, I think we're all struggling right now. I think for someone to say they're not, they'd be lying. And yeah, it's sucked lately.
I mean, it's difficult, especially having this full curfew. Like before, I was feeling like at least partial curfew, then at least once a week I could go, because by the time the 4 o'clock curfew came, I'm working, so I can't go after that. But at least on a Friday, I would like use the excuse to go to the grocery store, even if I have to stand in line, even if I have to sit for half an hour. It's just the idea of like you'll be in contact with other people. And then this full curfew, I feel like I'm like you. I just want to get the kids motivated where we have those 2 hours. So even when I don't feel like it, like definitely today I didn't feel like it. And then it's like, no, I got to put my shoes on. I got to walk. I got to see people. And when you start walking and you see a lot of other people walking, I mean, in my area, it's not congested. It's nice. Then you feel like, okay, thank God I brought my kids so they could see also other people. But it's been so difficult. It's really hard. And a lot of my clients also have struggling. And you know what? This is what I tell them. It's normal. It's okay. We don't have to be productive every day. I even tell myself, why do I need to get up early in the morning? I mean, I have a lot of papers to grade. Thank God for the university for having me teach really seriously. Like in another week, I'm done. And then I'm thinking, oh my God, what am I going to do now? At least I know I have to get up. I have to grade papers. I have to. And then I was, but then on Friday or Saturday, I'm like, why do I need to get up early? Let me just sleep in. Who cares? Who cares this? So I could only see what people are feeling right now when you don't have anything to do. You don't have a lot of specific routines.
Have you been more agitated, a little bit more moody?
Yes.
Yeah.
Yes. I've been yelling at the kids
I'm just joking. I'm joking, Doctor. I'm joking. I was just giving you a cheap crap. I'm just giving you a cheap crap.
Today I had to apologize to my neighbor. I swear. I called her because I thought she wanted to take a walk with us, but she's not feeling good. I said, and I want to tell you, I'm really, really sorry for the past 2 days. I have been yelling a lot. The kids are driving me crazy, especially my teenager. I mean, he's an amazing boy, but motivating him to finish because they're at the end of this e-learning now. And they have until June 3rd to do any incomplete. And he's done all his work, but now he's getting the feedback from his teachers and it's driving me crazy. He says he's getting things done, but also they are tired of being home all the time.
Yeah, yes.
He's distracting. He's not finishing a lot of his work. So I called my neighbor. I really apologize that I'm screaming a lot, just in case you heard.
Oh, so wait.
Like,
you can scream at the kids, but I can't give DJ a pat on the back and say, tough guy.
Looks. Yeah, no. I tell my kids, when I scream at you, you want to cry? It's okay. Cry. It's okay. Not like you.
I tell them, I say, DJ, if you're going to cry, I'll give you something to cry about, kid. No, I don't do that. Just so everybody knows, I do not do that with my child.
I give my kids reason to cry. So, cry, okay? I don't care.
What advice can you give to people that are going through these blues right now? I mean, I don't know if you saw my latest post, and I lift weights. You know that about me. I work out.
I saw your post because I know you're asking me this just to see if I did. I did. Okay.
You saw my post where I fell on my ass with the weight?
And you fell on your ass. Yes. I laughed.
I said in that post that it's okay for some days for us just to not to want to do things and not to have things to do. But for me personally, in my competitive edge, I can't do that. Like, I wasn't going to lose yesterday. And that's how I saw it. I was like, I'm not losing to this weight. It's just not happening. And that little victory, that little tiny victory I had yesterday that lasted a whole 15 seconds, you know what I mean? Made a huge difference. It made a ginormous difference in the day. And it's just tough, but it's okay to relax and be in your jammies, right? Like,
yeah. And that's why I was thinking Friday, I'm like, why do I need to change my clothes? Why do I need to I can just sit around, eat with the kids. I want to watch a movie, but of course I had all these papers to grade. But the thing is that what you were saying is that you just need to look for something small to make your day. You don't need to look for a lot. And I feel like people really need to do a different mindset right now. Right now, we need to start thinking about it is tough for everyone. This coronavirus, we don't know what's going to happen. All these political issues, all this should we believe this person or not? How much? I mean, our numbers here in Kuwait is we're doing all the right things, but they're going high because we're testing more. But still, people are like, oh my God, the numbers high. People should stop listening to the numbers. Seriously. I don't even look at the numbers unless somebody mentioned them to me. I stopped. I don't read any news here. In the evening, sometimes I'll read an article or two. That's it, just to keep an update. But I don't talk about coronavirus here at the house. I allow my kids to feel that this is the norm right now and we have to do what we need to do. Just like you were saying, a little thing like today we walked, I feel good.
Yeah.
If I can walk every day with the kids, I feel like that's an accomplishment. If I can grade 10 papers a day, that's for me, it's fine. So to me, I'm like you, I'm very competitive. I'm very self-disciplined, but we need to look for a small window to make us feel happy because everything around us is not happy. And you hear nothing. And if you're watching the news, I hope you stop because everything you hear is how it's bad, how many people are unemployed, who died. You know, you go on Facebook, the same thing, people dying, people, I don't know, complaining about they don't have a job, people complaining like in the US, when are we going to go back to work? And I feel like all of this is not healthy for us.
No, it's all doom and gloom.
We need to find something small that will make your day. If it's going for a walk or if it's finishing a task at work or if you just watched a nice film and it was funny.
And on the flip side, and this is something I'm so sick of seeing on friggin' Instagram and social media. I seriously, if someone I know posts another thing about being productive and you have to be productive or else your world is going to end, I'm going to kick you in the nuts. Like seriously, some people don't need to see that right now. Some people just need to get through their days. And then telling them and reinforcing them, you have to be productive. You have to work out. Like that's these little things, or you have to learn a new trade. You don't have to do anything. This is a traumatic experience, like Dr. Dinka said. You said this a few weeks ago. It's a traumatic experience. And in a traumatic experience, are you expected to lose weight? And are you expected to learn French in 3 weeks? I mean, come on.
Look, I'm a psychologist and I'm supposed to have the tools to be able to deal with this, but I feel also distressed and anxious and I don't know. And also because of my job, I get a lot of the negative energy from my clients who are scared. So I have to be able to constantly reassure them that things will be, but we gotta really accept the idea that it is a traumatic experience. We've never been through this in entire life. And this is something that we really need to learn how to deal with it. You know, one of my clients said it the best the other day. So we were talking about routine is important, whatever routine you have, as long as like your sleep pattern is okay or you've done something. So you know what she says to me? And I said, you know, try to get online, see if there's anything you want to. So she was telling me about this site that she is going to, learning about like manicure, pedicure, you know, simple things. She's not even a salonist or whatever they're. And I said to her, this is great. And she said, you know what, doc, you know, this is not a competition. It's not about how many certificate did I get from learning these different tasks. It's not about this or that. It's just about that I have done something for myself. But you see on Instagram, everyone is making it look like a competition, right? Everyone is saying, well, if you haven't accomplished these things, then you haven't really learned anything through this COVID-19. I don't believe that. I don't think that you should sit around and do nothing because that is just going to increase your anxiety and trauma. But I also think that it's not something like, I got to lose weight because Mahdi's losing weight. I got to get this, go on webinar and learn all these workshops because so-and-so told me. I think people should really realize what is their limitation now? What are their abilities now? We have to be honest with ourselves. Can I really manage all this while I am distressed? Maybe I'm not sleeping enough, or maybe because I'm exhausted with the kids' e-learning, or maybe my job is giving me a hard time. We have to really be easy on ourselves right now. When you're experiencing a great amount of stress, no one is going to think right. No one even cares right now in a lot of areas, right? So I feel like people shouldn't make it look like a competition. When you're in trauma, you're not going to be competitive in any ways. Do you need to work out? Well, I think that people need to work out just because you need to get the serotonin level equal. And I think you need to be able to have some sort of a direction when you get up. Like when I get up, I know I've got to grade. I got to talk to these people. I got to do that. Sometimes it's these tasks keep me going. So people need to understand. But if one day I don't have on the weekend, I don't care about tasks. I don't want to know about tasks. I want to be able to just sit around and do nothing. And you should allow yourself. Why not? Why do I need to be productive every day? I don't know.
Yeah.
To be honest.
It's a tough situation. It's a tough situation.
And everyone is out there on Instagram trying to diagnose and trying to give you, you know,
I love it.
If you're feeling like this. I love the idea now. The big thing is this hypochondriac, right?
Oh, yeah. Wait, hold on. Before we get into that, do you like my 80s hairstyle going on right here?
Who gave you a haircut?
Do you like the 80s hairstyle going on? Dr. D, just so the listeners know, like I Zoom with her all the time. And every time she comes on, it's perfect hair, perfect makeup, everything's perfect. And here I am. I'm like, literally, I just got out of the swimming pool, DJ. So I was looking at, I'm like, what is up with my hair? Oh my God. I need to leave my hat in this room. But yes, going back to what Dr. D was talking about, being a hypochondriac.
Does everyone think that they're hypochondriac? And again, let's just like define hypochondriac. I wanted to read it just to make sure people and you and I understand. Okay, so hypochondriac, of course, everybody probably have heard it, but it's preoccupation with having serious illness, misinterpretation of body symptoms, persistent fear despite medical reassurance, absence of delusions or psychosis. So you can have either one or it will be something else. Clinical distress or functional impairment. Now, why are people throwing around that they're hypochondriac? And if you are hypochondriac, and after COVID-19, we will be hypochondriac. Are they all meeting these criteria? Because I would like to really know these people. Do they really know what hypochondria is? Just because I'm really worried I'm going to get coronavirus, is that really abnormal? Everyone thinks that they're going to get it because we either know people that got it, we read high numbers. I mean, can you imagine 900 in Kuwait cases, were positive? Don't you think I'm going to start thinking, okay, what are my symptoms? Am I one of them? Should I be one of them? Don't you think that would be normal? Why am I called hypochondriac? I just want to know that. Do you know?
Me? No. I mean, because personally, I've been dubbed by Haya as a hypochondriac when it comes to health.
Or her?
When she was pregnant, all right? I was like freaking out, I think 6 months into her being pregnant. And I went to several doctors because I felt like I had something in my throat. And one doctor prescribed anxiety medication.
That's stress.
And I took
Actually,
it. Yeah.
That's a panic attack. That's one of the signs.
Popping these pills as prescribed. And
do you know what they were?
I thought they were to like relax my stomach.
You know what they're called?
I have no idea. I think it was. It might have been that. Haya looks at it. She reads it and she starts laughing. She goes, ha ha, you've got anxiety. I was like, what? She's like, this says there's nothing wrong with you physically.
Yes.
Over my lifetime, there have been a lot of times where like, oh my God, I feel like something's going on. I don't know why there's this. And I am a hypochondriac when it does come to illnesses. And I can see, in my opinion...
You meet those criteria? So which one? Preoccupation with having serious illness? Misinterpretation of body symptoms? Yes.
Yeah. That's a definite.
So you are the first one also. Preoccupied with having serious illness. You are one of them. Persistent fear despite medical reassurance. So you went to the doctor
I went to 5 doctors.
And the doctor says,
five doctors, 5 different opinions.
You meet the criteria.
100%.
You go to all these doctors and they jump from doctors to doctors because the doctor says nothing wrong with you. And they say, no, there is something wrong with me. I got to go to this doctor and this. So even when your medical doctor says there's nothing wrong with you, you still think you have and you didn't have any delusions or psychosis because then that would be called something else.
No, I didn't.
And you
no. Oh, hold on.
Absence. You had delusions?
I had visions, or not visions, like almost like daydreams. I envisioned myself being sick. It's not delusions, but I envisioned myself being sick. One of the things that I was reading before we got started was the research that's out with COVID-19 and the new association because of the anxiety that is driven behind COVID-19. So it is normal. You're right. It's normal.
You know what? I'm going to tell you, 80% of the population will be hypochondriac. When we hear nothing but everyone's going to have COVID. I mean, look at the numbers in the US. Oh, for God's sake, do you think if I was living in the US, I'm not going to think I have it? Like, it is so common. Like the other day, I feel like I was coughing and I couldn't breathe. I'm thinking, okay. I mean, I'm not hypochondriac at all because I'm like, whatever. I'm not even going to worry about it. But I could see like a lot of people, like I have several patients that say the same thing. The first thing they'll say, you know what? I think I have coronavirus. Why
so is there like,
that?
is that?
I don't have, most of them will say, I don't have the fever, but I have this and I have that. Okay. But the idea is that it might not be hypochondria. It might be that they might have it.
That's true, yeah.
That because we are bombarded by, have you ever looked at all the Instagram and the news? Yep. They're constantly telling you these are the symptoms of coronavirus.
Yeah.
If you have these symptoms, but if you have those symptoms, there's a possibility it could be something else. It could be also the flu. It could be like our neighbor's kid he's a small kid. He has fever. Suddenly, oh my God, maybe he has, coronavirus. No, maybe he doesn't. Maybe it's a regular flu that he has, and maybe it'll go away. But the idea is that it's true. Everyone is preoccupied with their health right now.
Yeah.
And does that make them hypochondriac? You already had a pre-existing condition. So I can see you could be. But if you didn't have a precondition and I was never worried about my health, and suddenly now I'm worried I might have it. Is this normal or not normal?
No, it's normal. You become hyper vigilant. You become hyper vigilant about whatever. I mean, yesterday I was sneezing all morning. Like literally, I woke up, I sneezed like 9 times. My nose is running. And I look at Hay, I go, oh my God, please God, don't tell me I have corona. I don't know what's going on.
That's allergies.
That's what she said. She goes,
Oh
Maddie,
my God.
your goddamn eye is watering. These are allergies, dude. Get with the program.
What is wrong with you?
I know. And I'm like, okay. I'm like, no, because I went to the store the other day. I went to the co-op. I did the whole sign thing. I triple masked everything. Like I had masks on. I'm going out. I'm in the co-op and literally I walk in. I got my stroller and I'm like, all right, anyone comes near me, it's go time. I'm just punching them in the face. I'm not even going to ask questions. Just don't come near me at this point. And this was a day ago and symptoms present itself in like 14 days anyways. So,
But I don't know are we called hypochondriac because you dress that way to go to COVID?
But is it temporary? Can you have it temporarily? Like just because of COVID? Can it be something
then it can't be called hypochondriac.
But you can't have like a temporary symptoms because of COVID?
No, it means that I'm temporarily worried I might get ill, but I wouldn't be called hypochondriac because I don't have a persistent preoccupation with illness. I haven't gone to 5, 6 doctors and they all told me there's nothing wrong with you. I don't shop and jump from doctor to doctor. I have not. The idea is that even these physical symptoms, for example, the thing in your throat, you misinterpreted it. So I don't have that. Like if I'm not breathing very well, maybe it is allergies. Like the other day, this other girl is like, she was like you. I'm having a difficult time breathing. My nose is running. I hope I don't have COVID. Are they serious? Like, did we forget about all the other illnesses we can have? Everyone now is going to have COVID. Everyone's going to die of COVID. Come on. So people are so preoccupied with the idea. And as soon as they have one symptoms, then it's like, okay, you must either have it or you're hypochondriac. No, it is normal for me to worry about my health. It is normal for me. If I have a fever, it's a possibility that I might have it. How am I hypochondriac?
Yeah.
I'm not.
I mean, you shouldn't dismiss symptoms if you have the major symptoms and like a fever and everything. Like for me, I wouldn't take chances.
What I'm saying is that it's normal to worry about your health.
Yeah.
So if you're worrying about your health and you're kind of worried about these symptoms, now the difference between what's normal and abnormal, as I always say, is that if it's affecting your life, if every day, like in a full curfew, you're making appointments to go from a different hospital because you're trying to figure it out, and this is preoccupying you and you can't sleep and you can't function on a daily basis, then that's abnormal. You might have moved into the hypochondriac stage. But if I'm just worried, but I'm not preoccupied, I'm still doing my job, I'm still doing everything, but in the back of my mind is like, oh my God, do I have a fever or not? If it's not affecting my daily function, then I must be normal. I mean, it is normal to think about an illness that we hear 24/7 about it.
Yeah, no, you're right. 100%. 100%. I agree with you 100%.
We can't just jump into diagnosing people and saying, oh, I think you're, or like washing our hands. We're all going to be OCD because we have to wash our hands. Am I OCD or am I just applying the medical laws or the Ministry of Health is saying you have to wash your hands? So am I teaching my kid to wash their hands so much? Or am I going to create OCDs? I mean, possibility, no. Don't forget that anxiety is also genetic. So if I have it in my family, it's a possibility that they might be anxious. But washing your hand all the time, and people are like, oh, we're all becoming OCD. We're going to be OCD. There's no guarantee we're going to be OCD. When this time passes, we're going to forget about our hygiene, I'm sure. Unless you already are,
It's about time people started washing their hands.
Yes. Again, people really need to differentiate between, am I OCD now? Am I hypochondriac now? We got to follow a rule of, there are certain rules, there's guidelines called American DSM, Diagnostic Manual, that says if you have this and it's persistent in 2 weeks, then you have it. But right now, I don't think that it's the right time to be diagnosing OCD and diagnosing hypochondria, because I feel like we got to diagnose people when we're not in this type of situation. When it's a normal situation and your fear of cleanliness continues and it's becoming a ritual, then that's when I diagnose it. But should I diagnose it now? No. Should I diagnose someone as hypochondriac at this moment? I disagree with that. I will not diagnose someone.
Can you be a hypochondriac over someone else's health? Like, can I be a parent and be a hypochondriac over my child's health?
No, it's your own condition.
What would that qualify as?
That would be anxiety.
That would just be anxiety. Because I know parents that are like, there's something wrong with my kid. There's something wrong with my kid. And they do all these crazy needless tests. Yeah. And like, there's absolutely nothing wrong with a poor kid. So what would you call it?
They must have generalized anxiety disorder. The parents do.
Okay.
Right. But this is the behavior. It's going to create the kid to be hypochondriac. That's another problem. This is a passionate topic. People need to just get off this idea of why are we labeling people right now, please?
100%.
I mean, is there never a time where you feel like you're living in a certain time frame or a condition that certain things should be allowed? That's what I want to know. Can my worry about illness and my worry about my kids or my ability to constantly say, wash your hand, could it not be in a frame of this condition and not be able to diagnose it?
Yeah. No, you're right.
Unless you have a pre-existing condition, yes. But I feel like right now, psychologists in general, maybe we should move away from diagnosing these type of conditions and concentrate more on how to get people.
That's a good point.
Survive.
That's a good point. Should psychologists even diagnose right now because of everything that's going on? Like, it's like running a research with a sample size. And don't you need all the conditions to be just right? Everything needs to be the same. Right now, it's not.
Yeah.
Like, if someone goes to a psychologist, how can you diagnose something given the current times that we're in? I mean, wouldn't that lead to like over prescribing, so to speak?
No, yes, no, it's over diagnosing, but you can't. You have to be able to diagnose people. If people are in war, right? And can you say that they are getting PTSD? It's a possibility. But we have to wait till they're away from war, from their conditions, to be able to see these symptoms. And that's why a lot of PTSD symptoms, we could see them within the 6 months, for example. The point, what I'm trying to say is that when someone is living in a threatening condition, in a traumatic condition, in a stressful condition, we cannot apply these kind of diagnosis. What we can do is help the person normalize it and realize, look, obviously, if it's making you psychotic or you're delusional and you can't sleep and is really affecting your behavior to a bizarre behavior, then we deal with it. But if you're saying to me, Doc, I didn't sleep all night because I heard my friend has COVID and now I'm wondering if I have it. My body's doing this. And this is all like in their mind, but it's not true because they went to the doctor's negative. Should I say, well, you're starting to become anxious? Should I say you're hypochondriac? Or should I say, no, I trust you. Believe me. If I were you, I would also be worried. This is normal. And see how long this is going to exist. If this is lasting for how long we've been in quarantine since March. So if it's been lasting from the beginning and now it's getting worse, then it's something I should worry about as a medical provider. But the idea is that if this person is really worried and their worry is valid, should I dismiss it? No, I'm not going to dismiss it. It's normal. Maybe people need to hear a lot more from psychologists and psychiatrists that there are certain things normal under the condition that we're in.
So you're saying for people that may experience this right now, be vigilant of the factors that trigger your anxiety effect. Avoid the news, basically. Avoid things that will trigger it and everything like that. And don't be negative about it. Don't let the negative stuff get to you that bad, right?
Yes, because you know what? If the person realizes, okay, under these conditions, of course, I'm going to be anxious. Of course, I'm going to feel like I might have corona. Of course, then maybe their anxiety wouldn't increase. Yeah. You know, I'm not saying that we have to walk around normalizing everything, but I also realize that we need to be able to help people understand under the circumstances, it is normal that even doctors and psychologists and other people that are aware of many things are also experiencing stress and trauma. I mean, there are going to be a lot of people that are going to have PTSD after this. All right. But we're saying after this. See, I'm not saying, so if you're struggling with trauma now, right, it is probably normal under the condition. It depends on also household condition. Is there a lot of problems in your household? Are you not living safe? But the idea is that people need to start realizing that under these conditions, maybe we shouldn't diagnose and wait till the person is out of that condition. So that way we can be able to really hone in on, is this regular anxiety? It's an adjustment, or is this really truly hypochondria or OCD or anxiety? That's what I think.
Yeah, no, that makes sense. And it makes sense what you're saying. If someone is suffering around you, make sure you're empathetic towards them. Make sure you give them some type of relief and, just keep them calm. It's scary because like, Haya keeps me calm. That's what I appreciate. She's like, look, I get it. You got to remember, stay focused, be cool. Like yesterday, she walked me through all the possibilities of why it's not COVID-18. And when she was like, your eyes are watering, that's when I was just like, yeah, I do suffer from bad allergies in general. You know what I mean? So it's good, and it's good.
And it's nice to have somebody like that. See, most people should have someone like that brings you down to earth. Because if we really let our imagination if you wouldn't have her where she just grounded you and told you, look, let's be realistic. If you didn't have that, now your imagination would have gone further, and now you probably had gone to 3-4 doctors by now.
And you probably would have contracted it by the time you went to the 4th doctor. Yeah. And it turns into a whole self-fulfilling prophecy, and then you're just screwed because you had COVID-19.
Yes. So it's nice for people to seek someone that is able to empathize with them, but also bring them to reality that, yes, it's okay to be anxious. Yes, it's okay to think that you have it. It's normal. But we have to watch your symptoms. Of course, if the symptoms really fit into the COVID-19 symptoms, of course. But the idea is that not everyone that has a fever, we say, oh my God, they must have coronavirus. Like, people panic, and you can't do that because then it scares the person more. Just because I have a fever or just because I am vomiting, diarrhea, it could be something else. We shouldn't just start telling the person you have coronavirus.
Hey, I had a really bad stomach thing. I think she ate something bad. And I was looking at her. I'm like, one of the first symptoms is like irritable bowel syndrome, right? And she's looking at me. She goes, I don't have goddamn corona. My stomach really hurts. Like she was keeled over. Her stomach was killing her. And it turned out it was definitely something she ate. Like, yeah, I'm the first to jump to that. But
see,
before we wrap up, here's an anecdote thing that I've always heard, and it's anecdotal, where if you truly believe that you're sick, or you always think you're sick with a debilitating disease that's going to kill you, you eventually get it and die. Now, from your perspective as a professional in the field, do you think there is any merit to that when people say if you keep believing you have cancer, you're eventually going to get cancer? Can we do that? Can we make ourselves sick? Is it possible?
It is possible because we know a lot about research of mind and body and how we can self-fulfilling prophecy. We all know that can also lead us. But the idea is really thinking that you have cancer getting you to cancer, or is it the stress that you're putting yourself under by thinking I'm going to get cancer? That's what gets you cancer.
Yeah, so that's a good point. Yeah.
Either way, the idea is that I am going to drive myself crazy to the point where the stress and lack of sleep, and of course, poor nutrition and diet and exercise is going to get me to have that cancer.
100%.
Because I've already been thinking. So it is in a way guides you, but I don't know if the thought itself, I'm going to have cancer equals I'm having cancer, but I think I'm going to have cancer causes a lot of other stresses in between that might generate cancer, or at least activate the cancer cells that we have in our body.
Awesome. I like that answer, Dr. D. I like that answer.
Good. I've impressed you today.
Yes.
Today,
See, it's supposed to be the other way.
I've impressed him.
It's supposed to be the other way around. Or like, Dr. D, did I impress you? Am I not getting fired today? Just so everybody knows, Dr. D wanted to fire me and replace me with Haya and Meg. And I will not forgive her for that. I will not forgive Dr. D for wanting to fire me. But
I said it's best to work with Haya and Meg. You just do the technical stuff.
I would
never get rid of you.
I know you can't. I'm too cool.
I love you. You're amazing. It's so great to work with you.
No, I know. I'm just messing with you.
Plus, you're the only one that can put up with that tells you I'm single. You're the only one that puts up with my personality.
I'm the only man in her life.
It's true. Beside my son, it's true. Even my son, I think by the time he's 18, he's going to say, that's it, Mom.
Why? You're awesome.
Well, I think I'm awesome, but I think he thinks I'm helicopter mom sometimes. So I'm trying to like whatever. What is wrong with being helicopter mom? I'm guiding you. I'm telling you what to do.
Look, I do the same with DJ. Like, I'm a helicopter dad, according to Haya. And she has to literally, like, dude, leave the kid alone. He's playing nicely by himself. Like, stop helicoptering. But in a way, it's good because there are so many parents out there that don't give a shit.
Yeah.
I mean, is it better to give a shit and care about your kid, or is it better not to care about your kid and, you know, let them develop bad habits, get into trouble, and eventually lead a life of crime and drugs? I mean, which one would you pick? You know, like...
I think we need to find you and I will need to find a medium. I mean, right now I used to be worse. And then I used to get really anxious, especially if I got an email. And then Larson has learned to say, Mom, can you just chill out? Okay. It's not that big of a deal. And then I realized, he's saying this to me. So I must have, because you know how sometimes parents, their reaction to things, it really gives messages to the kids that you might not be able to handle bad news.
Yeah.
And I'm like, really? I said, you worried about my reaction? He's like, Mom, yeah, your reaction. Don't worry. It's all under control. A couple of years ago. And then I decided, okay, I'll just ask you. And then you just like explain. So we can be helicopter parents because it drives the kid away from us. And then the other part, we're neglectful. So hopefully we'll find something in the middle.
Hopefully. And on that note, everybody, if you have listened to the show and got your free advice for the day and the month and the year, head over to iTunes, Spotify, or Stitcher and leave us a rating and review. Okay.
And make sure you say that you love me and you don't like Mahdi, because that is the reality.
Yeah. You know what? You guys can easily drive me off the show.
Dr. D.
Drive me off the show, please. Let me just handle things in the background. Honestly, that's the day I'm waiting for. Like, I really want to be in the background. I honestly do.
It will never happen. We will not allow that to happen.
You got to admit, I do come up with some good content, though.
You do, and good topics. You really do. I'm so impressed. You always say, let's talk about this, let's talk about that. And when you ask me, I always freeze like, okay. Maybe because I talk about topics every day that to me, they're normal.
Yeah, for you it is. Yeah, yep.
Yeah, so like, what should I talk about? What should I talk about? And then you're like, come up with these things. And I'm like, what the hell? Why didn't I think about these things? Even though I do see these things on a daily basis, but I don't remember them when we need a content. But thank you.
Yeah, I do it with other show too. I mean, what can I say? I'm a content genius.
You're just amazing. You're amazing.
No. But seriously, guys, head over to iTunes, Stitcher, leave us a rating or review, help the show out, tell your friends and family about us. We would love to have more listeners, and shoot us some DMs, send some DMs to Dr. D if you have any questions for us to answer on the show. And we have been doing lives every now and then. So keep your eyes peeled on Dr. D's Instagram. You can find her. It's what? Dr. Juliet Dinka?
It's Dr. No, what is this? Oh my God. Did I forget my Instagram?
I love it.
Oh my God.
I love it. Just so everyone knows, mine is Mahdi Al-Aoun. MAHDIALOWN. That's it.
I was right. It's Dr.J Dinka. So I was right. Why did I get confused?
It's all
See
right.
what happens when you're with Mahdi for an hour? Dr.J Dinka. So if anyone ever have any questions, please DM me. I'll be more than happy to answer.
Dr. D's been doing a lot of Arabic lately on Instagram.
Ah, yes. And it's not getting any better. My
No, it's good.
Is awful.
No, it's really good. Did you see my gym review in Arabic? It was horrible. All right.
No, I only saw the one in English. I like the way you're doing reviews.
The one in Arabic was really bad. It was what we call here in Kuwait bedliat. Like I said, a lot of the wrong words. Oh my God, it was horrible. One of my buddies called me up. He's like, dude, did you really put that on Instagram? I was like, look, at the end of the day, I have the balls to get in front of a camera and speak a second language. I'm going to do it, you know, like. But yeah, so.
Me too. And you know what? Everybody thinks I speak Arabic. So they've been writing to me a lot of Arabic stuff. I'm like, it's only 1 minute of Arabic. I'm not that perfect. And then you get all these people writing pages of issues that they want me to discuss.
Oh,
and
wow.
I'm like, how can I respond to this? Jeez, it's a hard work. But, you know, I want to do more in English, but I feel like
if you want English, head over to the projects page. Dr. D does drop some English bombs over there, you know. So you can head over to the projects page and check it out over there. Yeah, we'll get you doing more English on the project page. That's where you could do the English.
Yeah, we do. Yes, I do want to do more English.
Yeah, no, definitely. All right. On that note, thanks guys for
listening.
All
right. Bye, guys. Bye.
Thanks for listening to this episode. If you enjoyed it, please head over to iTunes to subscribe, rate, and leave a review. You can also find us on Instagram at The Project Kuwait. Thank you, and join us next time.